Joining us. We're going to give folks here a minute to log on. We just opened the room, so we are glad you are with us here today. You are in the right spot if you want to hear more about CARES spending and then some of the new guidance that has come out and a chance to do some Q&A. We're going to get started here in just a moment. I see the numbers are still increasing. We'll just give it till the numbers stop rolling. All right, I think the numbers have paused. So I think we're going to go ahead and get started. Well, good morning and good afternoon, wherever you are across America. My name is Denise Harlow. I'm CEO of the National Community Action Partnership. And thanks so much for being here. I know there's a lot going on. It's summer. There's just a lot of things going on, probably in personal lives, back to school, all sorts of stuff. But you've made time today to talk about CARES spending. And again, some of the new guidance that has come out, thankfully, we're very appreciative from the Office of Community Services. Next slide, please. But before we get rolling, you know you're here, so we're going to do the community action promise. So I hope that you'll say it with me wherever you sit. But community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. And during COVID, that embodying the spirit of hope, boy, that is what community action has meant to this country. And thank you for all of the work that you've been doing. Next slide, please. So today we were able to rally, the troops rallied. We didn't rally them, the troops rallied to bring all of the national partners here together for what we think might be our last CARES spending webinar, fingers crossed. Although I know we have small states who have another year. We're just going to put that note on that too. But we are joined by an array of folks here today who, again, we're going to do some presentations, some conversation, but we want to hear from you. We want to hear what your questions are that remain, because we know that clock is ticking. We're joined by Sharice Johnson and Verna Best from the Office of Community Services. We're joined by David Bradley from the National Community Action Foundation, Allison Malou from CAPLAW, Jeannie Chaffin from NASCSP, and Lana, who has been our CARES guru since almost day one on our CARES work here at the partnership. So again, thank you to all of our speakers and presenters for being here. Your expertise is so greatly appreciated. The time that you've spent on these issues to make sure the network is spending in the right ways, and we're doing so within the accountability framework. It helps us all today. It also helps us in the long run. So Sharice, thanks again for you and your whole team for being here today, and I'll turn it over to you.
Thank you, Denise, and good afternoon, everyone. Again, I'm Sharice Johnson, and I'm the Division Director for the Division of Community Assistance in the Office of Community Services. I have come very fond of these meetings. So after we spend out the $1 billion, I'm going to try to figure out what reasons will we have to meet now in absence of CARES spending. But this has been a great opportunity really to support the conversations across the network. And I do want to honor Denise's request is to make sure that we give you time to ask questions, because it's really all about the network getting their questions answered. So thank you, everyone, for joining. We're going to do two things from the Office of Community Services. We're going to talk a little bit about this IM in regards to mortgage assistance. I have to admit it was motivated quite a bit because of these conversations around CARES and how to help families recover. And then I'm going to give a brief update around where we are in our spending. But to kick off the conversation around progress that has been made because of the conversations that we've had with you, I'm asking Verna Best if she will go over the mortgage assistance IM and talk about that a little bit, and then Verna will turn it back to me, and we will have a conversation regarding where we are in CARES spending.
Thank you, Sharice, and thank you, Denise and team, and good afternoon, good morning, good evening, CSBG Network. As you may know, housing has often been cited as an important social determinant of health, and the absence thereof can negatively affect health and overall well-being. We also recognize that the pandemic has exacerbated what appears to be increases in homelessness, as well as access to quality housing. For these reasons and many more, OCS was and is ecstatic that we have published IM-163 CSBG Mortgage Assistance, Payment Assistance, informing the network that CSBG funds can be used to help a program beneficiary pay their mortgage costs. And I certainly know that we can't see them, but I hope you are using your virtual celebratory reactions, because this is historic, it's monumental, and it is pivotal to add this tool to the flexibility of CSBG to meet locally identified community needs, and as we prepare to wrap down our CARES spending. So you can go to the next slide. We know that maintaining a home for many people has been part of the American dream and has been recognized as a pathway to prosperity by way of wealth building and equity. So what we're asking is, as you read through IM-163, we know that it's relatively new and that there'll be questions for us to answer along the way. But for now, there are a few things that we are hoping that, that you will consider doing. And those things include updating your community action plans, policies, and procedures to allow for mortgage provision as applicable based on your specific community identified needs. We know that that's really an important step in making this come to pass. We also would ask that you spread the word about IM-163 at all levels throughout your organizations, as well as externally on your social media platforms and any other ways that you communicate, because we want to ensure that we are able to serve as many people as we possibly can through this new mechanism of providing services. And then, as always, we would just ask you to keep great work records and document your success, because this now becomes a part of the CSBG story on another level. So those are the things that I would share right now. Sharice, you may have additional information that you would like to add to this. But again, we are super excited about IM-163 and how CSBG now can be used to pay mortgage assistance for eligible beneficiaries. So that's all I have. Sharice, I'll turn it back over to you.
Thank you, Verna. I don't have anything to add, and I know there's going to be a discussion time later in this conversation today, so I'll reserve any comments I may have until that time. So now that we've had this celebratory moment, we're moving now toward how are we doing in regards to our care spending. So as we move to the next slide, you will see that we have actually obligated 81% of, or drawn down 81% of the total $1 billion worth of funding that was available. That is huge compared to where we started off in January, Denise. And so I think these conversations that we're having, the tools that were provided from NCAP and others, and the support from the entire training and technical assistance partners, as well as the OCS office, that we've made some significant strides in being able to spend this funding and obligate this funding before 9/30/2022. So you can see here where our states have at 82%, their territories are at 25%, and our tribes are at 57%. OCS continues to reach out to all of these different pieces of our network to make sure that we are providing guidance, we're providing resources, we're having one-on-one conversations, because we want to see this number get to 99% or 99.5 or 100% really, really soon. When we have conversations with the states, we're saying by mid-September, we really want to see that a narrow gap of maybe 1% may be available. And it could just be because of just some challenges with systems and things like that, but not because the money has not been drawn down. So that's the message that we want to send to the CSBG network and to all of you on this call. We've done a great job, but we have a little ways to go in order to show unequivocally that this money was needed, that the Community Action Network was responsive, and that communities are now better off because of this resource in their community. So we can go to the next slide to kind of tease this down just a little bit more. Next slide. So as you look at the slide on the screen, you can see by regions in regards to how people are doing. And so you can see regions that are at 51%, regions that are at 76 to 99%, but you can see we're making progress toward 100% of funding. And if you fall in any of these regions where there are questions, if you need assistance, if you need if you need support in thinking about from state to state how to spend the funding, please reach out to NCAP in regards to eligible entities and states. You can reach directly out to Office of Family Assistance and NASCSP, because we are I didn't mean to say the Office of Family Assistance, but the Office of Community Services. We probably could reach out to TANF and see if they can help us spend the money, but we definitely want you to reach out to the Office of Community Services, and we can help you explore ways in which this funding can be used. We see that some states are at, regions are at close to 100%, but we see there is some work to be done in many of the agencies across the country in regards to the region. We still have a little work to be done. But that's how that 19% is going to turn, this available is going to turn into 1%, as if we continue to push forward, continue to have conversations with the eligible entities to see if they need some additional support or guidance on how to obligate funding and get their invoices and things like that up to the state office so that you can draw down the money. Whatever it takes, we need all hands on deck to start to see these numbers close so that we can get closer to that 100% obligated and drawn down by 9/30/2022. Although I just told you the good news, I just wanted you to see how your work has been in action. You've gone from that 434 million. You can see when we started having this conversation all the way down as of August 9th, we're down at that $197 million amount. And so we definitely can see significant progress there. You see our tribes. So we have any tribal grantees that are online today. They can see what their numbers look like because there is more work to be done. If we could go to the next slide. And the next slide. There's more work to be done in regards to the tribes and working with the tribal organizations, and we are reaching out to them directly, as well as working through Lux, the technical assistance provider for the tribes. So there is some work to be done. We're making great strides and progress, and we want you to continue to stay true to this pathway so that we can get from the 19% available to closer to 1% or not more than 1.5%. And then we'll be calling you back again and say, how can we spend that 1.5%? But my point is that we're going to do, just for future reference, at the end of August, we're going to do another drawdown report. We're going to share that information directly with our national partners and see what other work we can do that may be a little more focused in regards to who may can help us move that closer to that 100% of spending. And then we're going to do a mid-September drawdown report, and we're going to do the same thing, because the important thing is that we not wait until 9/30/2022 and start trying to problem solve, because it'll be too late. We want to make sure that we provide updates to the partners at the end of August and again in mid-September, because that will give us a one final push. May not have a webinar, but one final push for some up-close training and technical assistance and support to kind of bring us across the finish line. So we're watching carefully. We're getting data from states specifically in our tribal organizations to see what's going on. We've recognized that there's some issues with how states' financial systems may work, and everything may not have touched the payment management system yet. But those are the kind of conversations that we'll be having moving forward. We will reach out to states directly and tribal grantees directly if we have questions. And of course, again, we'll share information with the training and technical assistance partners so that they can kind of know how to target some of their resources to support spending this funding down. So Denise, thank you for allowing us to come on and share this information. And we'll be on throughout this meeting just in case there are questions that come up from the people on this call, on this webinar.
Well, thank you, Sharice, and thank you, Verna. I think having the data in front of us is incredibly helpful. And I appreciate you adding kind of that cream colored piece that shows between that 50 and 75%, give or take. I think that that's a valuable number to have as well. So it's good to see a lot of the green, but we'd like to see more green. But so appreciate the data, and the data visualization is key, right? So thank you for that and your partnership through all of this. David, we're going to turn over to you. You certainly have the perspective of the message that needs to be carried forward publicly. You're navigating certainly the world of Congress, and we know that we have you to thank for this $1 billion, which is hopefully we know it's been put to really good use across this country. What would you like to share with us today for the network to hear?
Well, this is actually a pleasant experience. I'm impressed with where we're at. We're not quite at the finish line yet, but the network has really stepped up on this. And I was expecting to get on and say what I did before is that, do your best and be prepared to answer a lot of questions, why we didn't spend more, and a lot of oversight in Congress. I think we are close to and can get to a very solid success for this network. That it gives us bounce in Congress, that helps us rather than hinders future appropriation activities, future opportunities when they arise. So the network deserves, everyone involved deserves a lot of credit for where we're at. That said, number one, keep pushing. Yeah, everyone's going to tell you that. Keep pushing. Don't do anything stupid. Don't do anything get us in trouble, but keep pushing. Yeah, if we can get this over 90%, man, we're looking good. Second, there will be oversight next year on all these appropriation bills from 2020 on. You're going to see a lot of time spent in Congress looking at what worked and what didn't. Rather than viewing that as a challenge or as a threat, we should view it as an opportunity to really explain how important this network is and was in helping our communities meet this crisis. That's positive. And three, there will be lessons learned on this. What went right, what didn't go right. On any legislative environment, any legislative situation, there's always a debrief afterwards about the experience and things you could have done differently or why certain things happen. Same is going to apply to this. What went right, what needs to be improved upon, because there will be another opportunity. ARA was a decade ago. So it might be another 10 years, but there will be another crisis. There will be another time in which this network has a chance, and Congress gives it a chance to really play a significant role in a problem, in an issue, in a crisis confronting our communities. So let's use this after September 30th to pull back, look at what went right, what could have been done better, and let the chips fall where they may, whether it's federal, state, local. Just take an honest assessment internally so that we know how to improve what we're really comfortable what we did well, but how to improve on things that weren't as successful as we wanted. But generally speaking, I'll end where I started. Generally speaking, we're in a really good place, and this network deserves a pat on the shoulder and take off tomorrow. Have a 3-day weekend on us, in that this is a good thing that the network has done. They've really they're shining as we expected, and I'm really proud. So thank you.
Well, those words mean a lot, David. We so appreciate you and everything that NCAP has done, and I hope the network heard that. You have a lot to be proud of, community action, and I'm just going to slide this by very quickly because this is embargoed, but here's the new report that we'll be putting out into your conference bags next week in New York that will have readiness to resilience. Maybe you didn't see it because I wasn't spotlighted. Here it goes again. Oh, maybe you can't see because of the fake background, but anyway, it's beautiful. Just as the network just did some fantastic things. So thank you, David, for your uplifting words and your support throughout this pandemic and this response. All right, Allison, you get all the easy questions. So I'm going to turn over to you to try to address, I know there's the DCL guidance and there's a lot of things that come across CAPLAW's desk. You have been invaluable during this pandemic and as we've navigated these CARES dollars, as you always have been, but I'll turn the ball over to you to share with the group what you'd like to today. Thank you.
Yeah, thanks, Denise. And I've got the whole CAPLAW team here with me today. I've got Veronica Zhang, John Cohen, and Caroline Santilli here to all help and answer whatever questions anyone may have. I think we just wanted to quickly highlight again the Mortgage Assistance Information Memorandum. Can't reiterate enough what's already been said, what a really big deal that is, and how that is going to help with respect to those states and eligible entities that entered into that work with their CARES dollars. Now you can see that the Office of Community Service really worked hard to get us an information memorandum that gave us the flexibility we needed to do the kind of work that we do. And so, gosh, hats off to them for a great information memorandum that our network can really work with. And it will just serve us so well in the future. So happy to help talk through that with any states, eligible entities at any time, give our thoughts with respect to how that will play out in a practical sense. We also worked really closely with our national partners, NASCSP and NCAP and OCS to kind of come up with that Dear Colleague letter that was issued. It highlighted all the great work that LANA has done with respect to what people are doing with their CARES funding and how successful it's been. And so there's what we like to refer to as LANA's list, though it has a more formal name in the DCL, which is that's our code name for the list. And it really is focused on, how we are getting from point A to point B, C, and beyond with respect to this pandemic and the evolution of it, and how the services that we are and have been providing have evolved from the beginning of the pandemic to now, because this has been such a crazy time with all these different occurrences happening all throughout this period. So we've had to be very nimble and flexible and responsive. And as David said, we've been successful with that from the early days of just trying to protect ourselves, our staff, which we still are doing. It's an ongoing concern, to fighting inflation and the impact that that's having on our communities because of supply chain issues, because of economic issues, as we sort of ride back up out of the kind of hole we were all in for at least a year or so. So also in that Dear Colleague letter, we tried to address some of the burning questions that have been coming up towards the end of this CARES spending period for most of us. I know the small states are still out there, and still have some time to do some more spending, which is great. And so in there, we talked about issues such as, what do we do if we have a service or benefit that we're gauging into now, and that service or benefit is going to have some impacts beyond September 30th. And we talk about the ways that you can assess that service and benefit that you're providing now and determine the use of CARES funds to support it now, knowing that some of that benefit from that service is going to extend beyond September 30th, and sort of what documentation you would need to likely have in place, and what are the uniform guidance provisions that help to establish this sort of principle that when you use funds during a period of a designated grant period, that there needs to be some benefit with respect to that use of funds within that grant period, and what that looks like. We talk about gift cards, and OCS has recognized all along that gift cards are really critical in a time like this. And all you have to do is look to the federal CSBG Act to see that supporting families, especially our families in times of crisis, is one of the best ways to do it is direct assistance, and gift cards is a really great avenue and vehicle to use with respect to that. And so talking about what kind of accountability measures you would need to have in place, and really where the weaknesses could be with respect to gift cards, really at that organizational level, with the purchasing of the gift cards to then distribute, and then the accounting of those gift cards with respect to the distribution. We talk about also the purchase of supplies, and as we all know, the ending of any grant period that we've worked in, there's always a game that we play. How much can we buy that we will use during this period? How much will be left over at the end of the period? And that is something that the uniform guidance recognizes. They recognizes this sort of kind of game of residual supplies. And again, it's really focusing on that benefit that the supplies are providing within the time that you're purchasing, and why are you purchasing the supplies in furtherance of the funding with which you're purchasing them. So you want to make reasonable purchases, and you want to have documentation to support those reasons why you're making those purchases. And last but not least, the Dear Colleague letter touches on trying to maintain the capacity of our organizations. It is so hard to do all this work, and if everyone knew how much everybody's been doing and what we've been having to work through at an operational level, I think they'd all be even more impressed than perhaps they already are, because the challenges from a capacity building perspective have been probably some of the toughest, and they were pretty tough during ARA as well, because we had to ramp up quickly then, but then we didn't also have people getting sick and having to protect people, and so that was a whole new gloss that was placed on this time. So there has been a new recognition, it's always been there, with respect to using our funds to provide benefits to help retain, maintain, attract staff, and incentive compensation is a recognized use of CARES funds, as long as you are, and regular funds, as long as you are following the uniform guidance with respect to, having a policy in place, or at least documented or practice, that implied practice that you can show, and that you are using using factors and with which to assess the provision of any kind of incentive compensation. And so the DCL, the Dear Colleague letter, talks briefly about that, the uniform guidance rules, and also references a CAPLAW article that goes into great detail about incentive compensation, kind of the history of it from a legal perspective, because there is quite a bit of history there, and also kind of highlighting the evolution of it, and the evolution with respect to, I think, funding sources thinking with respect to it. I think if we had looked back 5 or 6 years ago, we would have never expected incentive compensation to be a tool in our toolbox, but it actually is. And so I think it's important for everyone to recognize that, and the Dear Colleague letter does just that. So with that, I'm going to stop, because I'm sure there are questions that might be out there with respect to the spend down of CARES funding. Also, if any of my colleagues want to jump on and add anything to what I've said, please feel free to do it. That's direct colleagues, CAPLAW, and all the other colleagues. Yep.
There's a quick question in the chat about the mortgage assistance. Are there limits to the amount of mortgage assistance that can be provided? Is it just past due payments, or can we do future payments?
So I'm happy to take a stab at, maybe, I don't know if Verna or Charisse, if you wanted to say anything.
Verna is going to comment on that, but Allison,
Okay.
can kick us off, and we can follow. Verna can follow with her comments regarding that, or vice matter.
Oh yeah, whatever. Yeah. So I mean, I would just say, like, the way that information memoranda is written, it's quite broad, and it's really intended to give the state the level of authority and discretion that states have with respect to the community service block grant funding, to kind of come up with what this program would look like within your state. And so I think that's going to really depend. What is the need? How are you documenting that need? And, what, as the IM says, what kind of controls are in place to make sure that those who are eligible are getting the payments, and that they are the ones receiving the benefit. There's no interest that's being provided to the eligible entity for the provision of payments, or any other organization or person for that matter. So I would think that that it's possible to help with payments beyond just the current payments. There could be, within that grant period, some future payments that could help to secure that housing for that individual and make sense within the program that the state has worked with the eligibilities within that state to kind of develop and produce. But Verna, I'll punt it up to you.
Yeah, and I would echo what you have shared. I think that I would encourage everyone to be very thoughtful and strategic about how they choose to implement this particular assistance. I think it's going to be, again, driven by your locally identified community needs, your policies and your procedures. I would want you to make sure that you have an approach that is going to be equitable. You don't want to start being kind of willy-nilly and doing one thing for this and something else for that. So I think you need to just take some time to reflect upon your own needs, your budget, what the guidance, what OMB guidance says about how you expend, and all those things come into play. But I do think you have some flexibility and autonomy to determine how this plays out in your states and in your local communities. So I wouldn't request any additional guidance. I think you should continue to ask your questions. And I'm sure as this moves along, we will find the right spots to kind of do some frequently asked questions and provide some additional support around those things. Sharice, I don't know if you wanted to add anything to that or not.
The only thing I would add is that we want to help people move beyond their crisis. And if you see, if paying, this is just me thinking out loud, if you're just actually paying one installment, is that one installment going to move people out of their crisis? And does your program design allow for that? So just thinking about the whole family, thinking about not just doing Band-Aid work, but helping to move people beyond the conditions that they're in would just be something I would ask you to consider as you develop your policies and procedures to support this flexibility.
Okay, great. I'm going to try to unmute Kristen Brown Thomas, who has a question.
You probably need to unmute on your side, Kristen, as well, or Kirsten as well.
I think we've done it on our end. Kirsten, can you put your question in the chat since we can't get the audio to work? Okay, so while we're working on that, there's another question in the spot. It's an example. Could we make payments to bring mortgage current, but the client on fixed income and will still have a monthly amount due on mortgage from outstanding amount? Client signed agreement to pay, but in this case, further crisis, we would allow flexibility for her payments, correct?
My response to that is that going back to what Verna discussed earlier, is that states and local entities need to start thinking about how they will implement these strategies, how they will need to either put policies and procedures in place to help families move to that better place. And it's very hard on these calls to give like answers to the what ifs. And so I don't want to do that, but I just want you to take the feedback from Verna and Allison, think about what you're trying to implement, think about the needs that you're trying to address in regards to mortgage assistance, think about what the, what's allowable, applicable, reasonable, all of those foundational things. And I'm sure that you would make decisions that are in the best interest of your communities that you serve. But typically we just don't like to give these kind of answers because there's so many other variables that could play into trying to answer that question. And I always want to make sure that we give you great answers and not mediocre answers, but we're going to always direct you back to what is your design and what is your plan.
Can I just, excuse me, also add that as you all are thinking about these things, that you not look at this additional tool as an end all be all. When you're asking specific questions like this, you really have to also consider how that family is being served comprehensively. And so that, again, as Sharice is saying, your program strategy and implementation should actually be able to help inform you as you look towards moving people out of poverty and into a more self-sufficient livelihood. So I would just encourage you to just be very thoughtful about knowing this is a tool, but it's not the end all be all, and you apply it comprehensively for how you're trying to move families out of poverty.
Well, the DCL and the IM perhaps answered everybody's questions.
Maybe.
Well, and it probably does add a lot of clarity, right? Because we know what the questions have felt like and look like on these webinars, as well as the CAPLAW conference Q&A session. So it's great to see that. Thank you again, OCS, for being so responsive to that real-time need from the network. I think you can see the evidence in the clarity that it's provided, so even though there's some fuzziness, right? Still some clarity. So thank you for that. I don't see anything else coming through the chat, Lana, do you?
Nope, and nothing in the Q&A either, so.
All right, folks. Going once, going twice, going 2.5 times. All right, we'll go 3. Well, thank you everybody for joining today. Those of you who are coming to New York City next week, OCS has also generously added a session on Friday morning for an OCS kind of update Q&A session. So that just want to put a pin in that, as well as all of the sessions that CAPLAW and NASCSP and OCS are doing. And many of you who are on today's call as peers coming to New York to do as well. So we thank everybody for your intentionality on this care spending, your focus on that 9/30/2022 deadline, and just keep doing what you're doing and be community action. So thank you, everybody, and we'll see y'all soon. Bye-bye.
Bye-bye. Thank you, everyone.